There are certain vocabulary terms and medical terms that once you speak them to a patient, they don't hear anything else you have to say after that, because there's just so much fear and apprehension, and they take a ride on the what if train that honestly they can't absorb any more information. And in the world of cardiology, two of those medical terms are the words heart and procedure. Once you say heart procedure, patients typically don't hear anything you got to say after that. They can't absorb it because the only thing that translates in their mind is imminent death. And we can't have them thinking that way. We can't. So there was a patient that I had to see earlier today that was recommended to have a coronary angiogram or heart catheterization. And you could see the look of fear wash over him, because in his mind, he was just thinking it's downhill from here. So I pulled up a chair, sat next to his bed, and we had a very thorough conversation. And by the end of the conversation, he was able to tell me, I'm ready to proceed with the test, not to die. I'm ready to proceed with the test. So I am going to have a conversation with you the same way that I had the conversation with him earlier. So student nurses, novice nurses, seasoned nurses, anybody who is interested, pull up a chair. Let's talk about today's episode of Make It Make Sense Cardiology Edition, the coronary angiogram or left heart cath. Now, in the interest of full transparency, heart catheterizations are not limited to the left system. You can also have a right heart cath to look at pulmonary artery pressures and certain other diagnostic features. But for today's teaching purposes, we are talking about the left heart cath, which looks at the coronary vascular system of the heart. The heart catheterization is the gold standard test to see if there's any blockages or arterial problems when it comes to coronary vasculature. You're not going to find any test that gives you more concrete and detailed information than the angiogram. Many different ways the cardiologist can get to the heart by way of coronary angiogram. And when I say that, I'm talking about entry points for all of the equipment. Present day, because of advancements in technology, because of advancements in medications, because of advancements in education, the radial artery approach, that's your wrist. The radial artery approach is the most common entry point. So at the radial artery, the cardiologist will make a very small incision. And of course, this incision site is going to be numbed up. It would be barbaric for us to cut on somebody without introducing some form of anesthesia, topical anesthesia for that. It's usually lidocaine, but dealer's choice. Nonetheless, through that incision, a tube called a catheter, hence the term catheterization, a tube called a catheter is inserted and then threaded all the way up the heart and into coronary circulation. There is a dye that is then injected into coronary circulation, and that dye will be able to be visualized by way of fluoroscopy. Fancy schmancy term that's very similar to like a closed circuit TV that they use in the cath lab. So once doc gets all of the equipment in place by way of the catheter, she will then inject dye into the coronary arteries. The dye will then illuminate or highlight the arteries on the fluoroscopy. And if there's anywhere that the dye does not move forward in circulation as you expect it to, that is your confirmation of a blockage. Depending on the location and the severity of the blockage, we fix it. So before I go into further detail about that, let me tell you that there are 4 potential outcomes for anybody who goes in to have a heart catheterization. Potential outcome number 1, and this is when the arteries are visualized on the fluoroscopy. Potential outcome number 1, there's no blockages that we see. Beautiful. That's what we hope to see. You never want anybody to have coronary artery disease. If that's what the doctor sees, then test done, work is done. Patient gets to recover in the recovery area for a couple of hours, just monitoring blood pressure, heart rate, heart rhythm, site for incision to make sure there's no wicked bruising, bleeding, anything like that. You've got a couple hour recovery time. And then from a cardiology perspective, chances are they'll be discharged from the hospital thereafter. Potential outcome number 2, mild blockages. when they get visualization of the arteries. Mild blockages, we'll take it. We'll take it. That just means that of all the arteries that were seen, none of them were blocked more than 70% in intensity. If mild blockage is what your cardiologist sees, then the goal of treatment is prevention. Prevent mild blockage from progressing into something more obstructive and more problematic, typically by way of cholesterol medications, diet, exercise, blood pressure control, all of that. Same recovery time, a couple of hours, and usually from a cardiology perspective, patients can go home if mild blockage is the only thing that's seen on their angiogram. Potential outcome number 3, significant blockage. Significant blockage means that in at least one vessel, we see 70% or greater blockage. Now, this is where it gets very, very tailored. Now, just because you see a blockage doesn't mean that it's amenable to intervention, meaning that you may not be able to get into that vessel to open it up. It is very tailored specific. You may have patients who have arteries that are very tiny, narrowed, twisted, that literally cannot accommodate the equipment necessary to fix the blockage. You may have patients with calcified disease, that if you go in and try to balloon angioplasty open that blocked vessel, you'll end up doing more damage than good. So just because somebody has 70% or greater blockage doesn't guarantee that they're going to get some sort of intervention. It is very tailored specific, but just know that 70% is the line of demarcation for determining whether or not intervention may need to occur. Now, if this patient ends up with a stent, then that is a cardiac appliance that they did not walk into the hospital with. Therefore, they need to stay at least one more night in the hospital for observation to make sure that the blood pressure stays nice and well controlled, the heart rate stays nice and well controlled, there's no reperfusion arrhythmias. I'm going to get into a different post about that at another time because there's a lot that I would like to teach you about that. And they need to make sure that there's no unusual bleeding. Now, for these stented patients, they are going to get started on dual antiplatelet therapy. Sidebar: if you don't know what dual antiplatelet therapy is, pause, go back and look at my previous post about that, bring yourself up to speed, and then come on back. And they can probably go home the following day, these post-stent patients, provided everything stays nice and status quo and they remain hemodynamically stable. Potential outcome number 4, severe blockage. We don't like severe blockages because that means at least 2 vessels, possibly including the left main artery, but at least 2 vessels are greater than 70% blocked. If this is what your cardiologist sees, then you're not getting stent after stent after stent after stent. Research has shown us that that leads to very poor clinical outcomes. And it's at this point in time where the heart catheterization procedure comes to a close, same recovery period like everybody else, and then you'll have the conversation with your doctor whether or not bypass surgery is in the cards for you. There you go. That's in a nutshell. So when you explain the heart catheterization like this to your patients, not only do you give them greater understanding of what the procedure is, but you've told them how it's performed. You've told them about potential outcomes so they can kindly step off of that what if train and they have a bit more certainty and a bit more reassurance about what to expect when they get carted down off into the cath lab. Good lesson today. Y'all did good. Very, very proud of you. I'm going to go back to seeing patients. Please remember to have a great day. Seasoned nurses, give your novice nurses and your student nurses a pat on the shoulder. Just give them a little bit of reassurance and encouragement. Let them know that nursing school does get better and life as a nurse is absolutely phenomenal. I will talk to y'all later. Have a good one. Bye.